what is it that we're trying to do? And if it's about improvement, then we would be inviting our consumer representatives as an equal player around the table when we're making our healthcare decisions. Our clinical leadership, we need to ask, how open are our clinical leaders to being challenged on some of their fundamental beliefs that they've carried with them for a very long time. Equally, we need patient leaders who are able to step outside themselves and get outside their experience and being able to speak at a high level, being able to analyse what they've learnt and what they've experienced through their own personal journey through the health system and be able to come out the other end and being able to share what they've learnt so that they can actually help make the system better. The role of the patient representative or the consumer representative is in fact to challenge the thinking so that we get the best possible discussion, debate, and actually work out what's important at the table so that good decisions can be made rather than rest on what we believe to be the right decisions.
It's really important that the experience of the health consumer is heard and taken notice of. This is because they're the ones using the system. They have experienced what is working for them and what is not working, what makes their recovery easier, what makes it more difficult. So the important thing is that their voice is heard, and there's a number of different ways that their voice can be heard.
It becomes very important that we actually allow our patients to take control of their bedside interaction with their clinicians, and if you like, our clinicians become their advisors. The only other thing that I would also say is to challenge our assumptions. Often we believe we already know what the patient thinks, feels, and I suggest that occasionally we're going to be wrong. So the more we listen, the more we will hear from our patients.